If you can make your tinnitus louder just by moving your jaw, clenching your teeth, maybe shifting it from side to side, it might not be an ear problem at all. It might be your jaw hijacking your hearing system. I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus in Utah. And after 20 years of treating tinnitus patients, I can tell you this. Jaw problems don't just cause annoying ringing, they can actually amplify tinnitus through specific nerve pathways connecting your jaw and your hearing system. And here's what we see a lot. People try every tinnitus treatment under the sun, and nobody ever checks to see if the jaw is part of the problem. So today, we're going to look at exactly how your jaw can affect your tinnitus, what's happening inside your nervous system, and what proper treatment looks like when TMJ is involved.
If you're navigating hearing loss or struggling with ringing in your ears, then you've come to the right place. The All Ears Hearing and Tinnitus podcast is your go-to source for expert insights, real stories, and cutting-edge solutions in hearing health. We'll dive into the latest advancements in hearing healthcare, explore groundbreaking treatments for tinnitus, and offer practical tips for better hearing. Here to help you tune into a world of better hearing, here's your host from Timpanogos Hearing and Tinnitus, Dr. Layne Garrett.
First, let's be clear about how common this is, because it's not something that's rare. A 2015 study from Taiwan looked at insurance data from thousands of patients and found that people with temporomandibular joint disorders had a 2.73-fold higher risk of developing tinnitus compared to people without TMJ problems. That's nearly 3 times the risk. And tinnitus prevalence in TMJ patients? Studies show it reaches about 60% compared to 15 to 30% in the general population. When you've got TMJ dysfunction, you're way more likely to have tinnitus. But here's where things get really interesting. A 2019 study from Sweden looked at people with severe tinnitus and found that 36% of them also had TMJ complaints. When we look at the most recent bothersome cases of tinnitus, TMJ problems show up constantly. Now the question to ask is, why? So what is that connection between your jaw and your hearing system? It comes down to a nerve called the trigeminal nerve. The trigeminal nerve, that's the 5th cranial nerve, controls the sensation of your face and your jaw. It's what lets you feel when someone touches your face, and it controls the muscles that you use for chewing. But here's the part most people don't know. This nerve also has direct connections to your hearing system inside the brainstem. Think of it like this. The nerve fibers from your jaw and the nerve fibers from your ear meet up at a processing station in your brainstem called the cochlear nucleus. That's where your brain first starts making sense of sounds coming from your ear. So if information from your jaw is literally mixing with information from your ear in the same place, they're not separate systems running parallel. They're interconnected and talk to each other. The trigeminal nerve also controls 2 tiny muscles inside your ear, the tensor tympani and the tensor veli palatini muscles. These muscles normally help protect your ear from loud sounds and keep pressure balanced in your middle ear. But when they start contracting too much because of jaw tension, that can create earfulness, pressure, and tinnitus. A study on how jaw movements affect tinnitus found that about 2/3 of people with tinnitus can change the loudness or pitch by moving their jaw, turning their neck, or pressing on their head. The jaw joint was the #1 spot that affects tinnitus. What's happening when you clench your jaw? You fire up that trigeminal nerve. Those nerve signals travel to that shared processing station in your brainstem, and they change how active your hearing neurons are. If those neurons are already overactive, which is what happens in tinnitus, that jaw movement can push them even higher, which your brain interprets as louder tinnitus or a different pitch. This is something called somatic tinnitus, and it's not subtle. Some patients can make their tinnitus twice or maybe 3 times as louder just by clenching their teeth. So how do you know if your jaw is actually contributing to your tinnitus? Let me give you an example. We recently had a patient in her 30s come in, and she could literally change the sound of her tinnitus just by clenching your jaw or shifting it side to side. No one had ever connected that to her jaw before, but within minutes of testing it was clear. The TMJ tension was lighting up the same nerve pathways we just talked about. That's the kind of pattern we look for. The first and most obvious sign is we'll ask you, can you change your tinnitus with jaw movements? If you open your mouth wide, you clench your teeth, or move your jaw side to side, and your tinnitus changes in loudness or pitch, that's a strong indicator. Second, we can check to see if you're having any jaw clicking or popping or pain when you move your jaw, difficulty opening your mouth fully, pain in the jaw muscles when you press on them. These are signs of TMJ dysfunction that might be feeding your tinnitus. And third, we'll check to see, did your tinnitus start about the same time as your jaw problems? Or did they get worse when your jaw issues flared up? Timing here does matter. And here's something important. Even if you can't consciously change your tinnitus, that does not rule out TMJ involvement. Some people have chronic jaw tension or inflammation that's constantly affecting those signals to the hearing system. They may not be able to turn it on and off with jaw movements, but it's still making things worse. And here's the thing. Younger patients, often women who can change their tinnitus with movement or have jaw or neck complaints, when we see that profile, TMJ involvement is very, very likely. But the research also shows this. Tinnitus patients with TMJ complaints are less likely to have the usual tinnitus risk factors like significant hearing loss or older age. That suggests TMJ dysfunction might be actually causing or maintaining the tinnitus, not just showing up alongside it by coincidence. So, if TMJ is involved in your tinnitus, what does proper treatment look like? Because this is where a lot of people get stuck with ineffective approaches. First, treating TMJ-related tinnitus isn't just about your jaw. It's about addressing the neural connections we talked about. That means working with multiple systems, the jaw itself, the neck, the muscle tension, and the nervous system's response to all of it. A 2020 randomized clinical trial looked at patients with tinnitus that was attributed to TMJ disorders. They compared two groups. One got exercise, education, and manual therapy targeting the TMJ and neck muscles. The others got just exercise and education without the manual therapy. The group that received the manual therapy had significantly better outcomes, large effect sizes for reducing both TMJ pain and tinnitus severity. Their tinnitus-related handicap scores improved dramatically, and these improvements lasted. That followed through patients out to 6 months post-treatment. What was that manual therapy? Soft tissue mobilization of the jaw muscles, joint mobilization of the TMJ trigger point therapy for neck and facial muscles, combined with exercises to improve jaw mobility and reduce muscle tension. Other systematic reviews have confirmed this. Physical therapy approaches, including cervical spine manipulations, jaw exercises, trigger point treatment, and splint therapy, have all shown positive effects on tinnitus severity when TMJ or neck dysfunction is involved. Now here's the reality about timeline. Improvement takes time. Clinical studies show it can take up to 14 weeks with physical therapy, up to 24 weeks with splint therapy to see meaningful improvement. So if someone tries a night guard for 2 weeks and gives up because their tinnitus hasn't changed, they quit too early. And interestingly enough, one study found that in patients with TMJ-related tinnitus who received proper treatment, the tinnitus completely disappeared in 27% of them. That's not just learning to live with it, that's actual resolution. But you need the right providers involved. This isn't something you DIY with jaw stretches that you found on YouTube. You need evaluation by someone who understands both TMJ disorders and tinnitus. That means working with a physical therapist who specializes in TMJ dysfunction, coordinating with a dentist who treats TMJ issues, and an audiologist who can assess the tinnitus component and track changes over time. In our clinic, when we identify TMJ involvement, we coordinate care. We're doing the comprehensive tinnitus assessment and management, but we also refer out to a TMJ specialist when that's appropriate, because addressing the jaw problem without addressing the tinnitus distress doesn't work well. And treating tinnitus without addressing the mechanical jaw issues leaves half the problem untreated. Now, a couple of important things to understand. First, TMJ doesn't cause tinnitus from nothing. What it does is amplify tinnitus that's already there. The research suggests it's affecting how your brain processes tinnitus, making it louder or more bothersome rather than creating the tinnitus itself. Second, just because you can change your tinnitus with jaw movements does not mean TMJ is the only factor. You might have hearing loss that's contributing to it. You might have noise damage. Multiple things are usually involved simultaneously. And third, and this is crucial, fixing your jaw dysfunction might improve your tinnitus significantly, but it might not eliminate it completely. Especially if you've had tinnitus for years, there are likely some central nervous system changes that persist even after the peripheral TMJ problem is addressed. So realistic expectations matter here. We're looking for meaningful reduction in tinnitus severity and distress, improved quality of life, and a better ability to function, not necessarily complete silence. The bottom line is, if you can change your tinnitus by moving your jaw, if you have jaw pain or dysfunction, and if you're younger than the typical tinnitus patient and don't have significant hearing loss, TMJ involvement of your tinnitus is pretty likely. And the good news is this is treatable. The research shows that physical therapy, manual therapy, and proper TMJ treatment, these approaches work when TMJ is related to your tinnitus. but you need comprehensive evaluation and some coordinated care, not just a night guard from your dentist and hope for the best. The anatomy here is real, the neural connections are real, and when we address everything properly, patients do get better. Now, I want to hear from you. Can you change your tinnitus with jaw movements? Have you tried TMJ treatment and did it help your tinnitus? Drop a comment below. Your experience helps others people understand exactly what to expect. And if you want to learn more about what comprehensive tinnitus evaluation and treatment looks like, I've put together a free learning center with detailed information about different types of tinnitus and evidence-based treatment approaches. The link can be found in the description below. And if you're here in northern Utah and want a real evaluation for your tinnitus and potential TMJ involvement, you can schedule an appointment in one of our offices. Understanding the connection is the first step towards actually treating your tinnitus.
A world of better hearing and relief from tinnitus is within reach, and we're here to help. Be sure to subscribe to the podcast right now and join us on the journey to clearer sound and a richer life. Thanks for listening to the All Ears Hearing and Tinnitus podcast with Dr. Layne Garrett. We'll see you next time.